Hi guys, thanks for joining, appreciate you, and thanks for all your help and support. Hopefully everybody's being safe out there. So something I've been seeing a little bit here common, unfortunately, is a type of cancer called Hemangiosarcoma, HSA for short. So there's a couple different subtypes of this. There is a cutaneous form that patients can be predisposed to with kind of UV light. So think of it as cutaneous hemangiosarcoma as sun cancer is a way of thinking about it. Not quite the same, but we do tend to see it a lot more frequent in patients who sunbathe more, particularly our white dogs, white-coated dogs like our white pitties here in El Paso. But any breed can get it. So try and minimize that. You can actually put sunscreen on your dog's bellies and their noses. Just make sure you use a zinc-free one, and that can actually help prevent it just like it does in people. So a little FYI tidbit for you, for those of you who want to try and be a little proactive and possibly prevent a sun cancer on your fur babies. So more so, the one I've been seeing here lately is the internal kind. Hemangiosarcoma is a type of cancer that spreads through the blood, so through the vasculature. The vast majority of the times when we are seeing these, we are seeing them in the spleen. Depending on if there's a small mass versus a large mass, there's all kinds of variables with how patients present. Some of them will go down for a day, and then Mother Nature or the biological Band-Aid, I call it the omentum. It's actually the omentum, and I call it the biologic Band-Aid. We'll kind of seal it, and sometimes they pop right up and do good for a little while until they have another rupture or leak. Now, depending on how big the mass is, whether it's, golf ball size or smaller, or baseball, softball, or even basketball size, volleyball size, changes how these guys will present. Sometimes if there's a small tear, they'll gradually go down. If there's a big rupture, they can literally just fall over dead. So some of those can be very unpredictable in how they present. Unfortunately, for some of my recent patients here, we have not only had the suspected hemangiosarcoma, but they've also had them metastasize. So what that means is they have spread. This particular cancer, one of the areas it likes to spread to a lot is the heart or the cardiac base. So right along the atrium, so the top of the heart when you're looking at it. That's called the base of the heart. The pointy part of the heart is called the apex. So usually up at the top. Once you kind of start thinking about it, it makes sense that a blood cancer would spread to other areas where there's more blood flow, aka the heart. That's a big concentration of blood, and we do tend to see a lot of them lodge in that heart. So usually there's no warning by the time we identify these. Usually most of these patients, the average survival time or mean survival time is usually about 2 to 3 months. Once again, that varies dramatically on, is that mass ruptured? Is it a small leak? Is it a big leak? How big is the mass? Lots of variables. So that can be very quick to very slow. Once it gets in the heart, there's not a whole lot of options. There are some chemo options. If you're going to go see a specialist, you might be able to do some radiation and some other newer technology, newer chemotherapies. The vast majority of the ones we find are in the spleen. The good news with that is we can go in surgically, remove that spleen, and it's a little bit of a guess if we've caught it before it's spread or after. You can do more imaging like ultrasounds and CTs and different things. Every client has a different budget. Every client has different depths on how far they want to go or not go. Because realistically, a lot of these are older patients, and sometimes it's a lot to ask somebody to do for chemo, the ultrasound, and CT, the surgery, so on and so forth. So to each their own. Just try and do the best you can for your little fur babies, and go from there. Chemo can work fairly well. So just to give you some general numbers, Usually when we see these, it's an emergency. We have a blood-filled abdomen, and usually we'll go in surgically and remove that spleen. A lot of patients actually do fairly well as long as everything else is good. Surgery alone, when it is an aggressive cancer, usually buys you a couple of months. Surgery with chemo, the numbers that are out there, are around 6 months plus or minus, but very few patients make it past a year with aggressive cancer that has already spread. Usually it gets to the heart or another important organ or area, and you have more complications. So hopefully that educates you guys a little bit. You can see them in all species. We see them a lot in our dogs, occasionally in cats. They get a different type of cancer in there more commonly, but you can get anything in there, and just touch base with your veterinarian. Sometimes there's things we can do to buy you quite a bit of time, sometimes not. Problem is, we don't know till we get in there, get a sample, and usually we're going in for that surgery to get that sample. So, hope y'all learned something. Thanks for joining, and we will see you later. Bye.